I'm going to be talking about how to add an extra £1,000 per week from facial aesthetics. So I just want to see who's here. Who's doing facial aesthetics at the moment? Who's not doing facial aesthetics? You can tell by all the 4 headlines who's not doing facial aesthetics. Thank you for that. So my name is Dr. Singh. I run a training academy. We teach throughout the UK and we go to Cardiff as well. So we do local regional workshops. There. So first of all, remember the talk title, how to add an extra £1,000 income per week. So what you want to do is break that down in terms of how many patients you want to see. Because if you say, okay, I need to earn £1,000, especially when you're training your team, getting your marketing agency on board, it's a harder figure to qualify. So we want to work backwards. So as we said, we want to earn £1,000 per week. On average, let's say you're just doing Botox treatments, it's about £250. That's quite conservative. We're going to assume you only have one patient that only has Botox treatment. They don't have any fillers, they don't have any skin treatments. On average, my patient spends about £1,600 throughout the year. But let's be really conservative. They're only coming in for Botox. So 1,000 divided by 250 is basically 4 patients per week. So if you're working 4 days a week, I know those Indians are working 7 days a week, but if you're a normal person working 4 days a week, you only need to see 1 new patient per day. So the reason we break it down to this way is an easier figure to manage. It's an easier figure to train my front of desk reception, my team, my associates, my hygienists go, look, our goal is only to see 1 new patient a day for facial aesthetics. Then we'll hit our target of an extra £1,000 per week. You would only have to do that for the first 6 months, because after that, they're going to get hooked. Who's seen Breaking Bad, the series on Netflix? We are like drug dealers. What do drug dealers do? Get them hooked on the first one really cheap or free. They will keep on coming back. Obviously, don't tell the GDC that, we'll get stuck off. So 1 new patient a day for 6 months, then they'll keep on coming back. This is a very conservative figure because they will have other treatments as well. Who thinks they can manage 1 new patient a day? Hopefully. You definitely can. It's not that hard. So I'm going to talk about how to get that 1 new patient a day. So I'm going to talk about my 3-step framework, how to get more facial aesthetic patients. The good thing is, without spending a penny. Who likes free marketing? Very good. Put your hands up there. So I did my facial aesthetics training back in 2002. Got really motivated, passionate about it. Went back to my dental surgery, stuck a few posters in the waiting room, and I thought I'll have a flood of new patients. I think I saw about 1 patient in 4 months. Yeah, I lost interest, lost my confidence, lost my competency. I cancelled my insurance with Hamilton Fraser, decided to go back to dentistry. And there's a scary fact that 80% of dentists that do facial aesthetics training don't implement. They give up after 1 year. And I was one of those dentists. Then I learned about marketing, business strategies and tactics, but I didn't learn from within the industry. I learned from outside the industry because business is business. I went to a Microsoft conference. I went to a state agency conference because if they worked, let's say they had a really good referral program, I could translate that to my dental business and facial aesthetics business. Because the problem with dentistry is everyone's copying everyone else. They're looking at what everyone else is doing. It's just going to be a race to the bottom. So strategies I'm going to talk about, I learned from different industries. So let's have a look at framework number 1. This is going to be the easiest, take you the least time, and cost you absolutely no money. So at the end of every dental appointment you have, whether you're a hygienist or dentist, sit the patient up. Let's say you've got Mrs. Jones. You would say, Mrs. Jones, I know you won't be interested. Just to let you know, we've started offering facial aesthetics. Here's 5 of our referral cards. If you do know anyone interested, please let them know. So you probably want to write this down again. So, Mrs. Jones, 30 seconds it will take. So, Mrs. Jones, I know you won't be interested. We don't want to offend that patient. You don't want to say to the patient, you look a bit haggard, you need some Botox, you'll end up with a black eye every night. So, Mrs. Jones, I know you won't be interested. So if they're not interested, you haven't offended them. If they are interested, they'll butt in and say, actually, I am interested. So, Mrs. Jones, I know you won't be interested. Just to let you know, we started offering facial aesthetics. If you do know anyone interested, here's 5 of our referral cards. The reason we give them 5, if I just gave them 1 card, they'll think of only 1 person. That's how the mind works. If I give them 5 referral cards about facial aesthetics, they think of 5 people, friends, family, work colleagues. So 30 seconds at the end of each appointment. Who's going to do that? No one needs the money from facial aesthetics? There. I tell everyone, I've been telling people for about 3 years that not many people do it. If you do it, you will easily get your 1 new patient. Because on average, 10% of your dental patient lists are already having facial aesthetics. They're not having it with you because they're not aware that you're offering it. And we always say, pick the lowest hanging fruit. You've already got that trust and credibility with your existing patients. They will come and see you. Okay, number 2, who collects patients' email addresses? Very good. Who sends a newsletter out to patients? Very good. So, newsletters. We have to have a block sometimes. So when I started doing newsletters, I thought, 1, patient's going to deregister. The more newsletters I send, they're not going to be happy, they're going to think it's spam. You have to add value to your newsletters. So what we found, so with BTC, my training academy, we send something called a weekly pulse, a weekly newsletter. We used to do it once every 6 months and once a quarter. Every time we send a newsletter, we get more sign-ups for our courses. The more times you communicate with your patients, the more you're going to get sign-up. So if you're not doing any newsletters to your patients, I would do it every quarter. So every 3 months, you're going to send a e-newsletter. Obviously, you need their permission. So when you have your medical history form, have a tick box say, you give us permission to send you marketing communications. So you have to be GDPR compliant. So we're going to be sending a quarterly newsletter. What do we put in the newsletter? So let's say this is our email newsletter. So same again, it doesn't cost you any money. And we divide it into 3 parts. The first part is educational. We don't want it to be spam, so we're going to give them something of value. So if a patient sees again something every quarter of value, they're not going to unsubscribe. They're going to remember you a lot more. So we're going to give them educational advice. So it could be, for facial aesthetics, how to look after your skin in the summer, how to prevent premature aging, etc., etc. Same again, you could do it for your dental services. But what you want to do is something called hidden bullet points. So in your email subject line, whichever software you use, the more people that open that email, the more people that will see that email. The software won't see it as spam. So let's say I was running a course on complaints, patient complaints. I could have the title, How to Reduce Patient Complaints. You may get some people coming to the course. If I use the strategy of hidden bullet points by saying the 4 Ps you must know to reduce patient complaints, I'm going to get more people either opening that email or attending that workshop because they want to know what those 4 Ps are. When you come on my course, they let you know what those 4 Ps are. So same again with premature aging. I talk about the 5 S's you must know to prevent premature aging. If I send that as an email to my database, they are bound to open that compared to how to prevent premature aging. So have the hidden bullet points. So the 5 S's are sun damage, lack of sleep, spirits, smoking, stress. Spirits in terms of alcohol, not spirits in terms of ghosts there. So have hidden bullet points in your email headlines, your newsletter headlines. So a third of it's going to be educational. The second third is personal. That's why we're on social media. We're nosy. We want to know what people are up to. But make it positive. Someone got engaged, someone got married, someone had a baby, etc. Don't do what one dentist did. He put on his newsletter, I sacked that crap nurse. So don't say that on the newsletter. So make it positive. And then finally, then we have our promotion. Treatment, let's say you just started offering facial aesthetics, that's where you can talk about, we just started offering facial aesthetics. Invisalign, teeth whitening, etc., etc. So follow that template when you do your e-newsletter, get their permission. Also, social media posting, we do the same with our patients. A third of our posts are educational, a third are personal, and a third are promotional. Because if you just do it all promotional, it's going to be spam. Because especially with social media, it's like no one would go to their neighbor's barbecue, go in, talk to no one, eat all their food and leave. That's what people do on social media. It's all blast, promo. They're not adding value.